Well, for Ebola now, it's more than 2,000 cases, and the mortality rate is nearly 70%, which is an absolute crisis. That means that more than 70% of our patients, or the confirmed cases of Ebola, have died. So it's absolutely excessive, this mortality rate. And just in the last few months, we've had 1,000 new cases, so it's accelerating at a very intense speed now. Well, this is the worst outbreak that they've had in DRC, and so far it's the 10th outbreak that they've had over the years, and it's definitely the worst. So now that we're trying to support the population, but there's a lot of movement of people. There's a lot of reticence to come and access healthcare because of the fear of the population. So it's becoming very hard to control. I think the main lesson to keep in mind is that if people seek healthcare early, then the rate of mortality is a lot lower. So it's only when people come too late, when they've been experiencing the virus for several days, that the probability of dying is a lot higher. So we need the population to trust and to understand that they can come as soon as they have symptoms. We'll look at whatever they're suffering, and maybe it's malaria or maybe it's something else, but they shouldn't hesitate to come to us, and then we can treat them early, and this will greatly reduce the number of deaths that we're seeing. I think the problem here is that there's a lot of cases, but they're very scattered. It's hard to isolate them to a single location because they're in a wide geographical area. And in DRC, in this outbreak, we know that a lot of people might be scared to come to a facility when they have symptoms. They have a fear of going to the treatment centers and being sent there because, well, the mortality rate is very high. So it's a bit of a vicious circle. We have people that wait a long time before coming to seek healthcare, and that means that the mortality rate is high. And then they wait longer to come because they're scared of dying in the facility. So this is the cycle that we need to break now. There's one lady from an insecure area, and she understood very well Ebola, the symptoms, the signs, and the need to access healthcare. But because of the insecure situation, she would not move from her house because she wanted to protect her children. So I couldn't imagine what she had gone through to make this decision to stay in her house where she knew maybe she had Ebola, maybe she was affecting her family, but then to leave them alone and go to seek healthcare when there is conflict going on and there's attacks from different groups. It was a difficult decision. In the end, though, the whole family was supported to visit the health facility, and there's been systems set up, even creche type systems to look after the children if the parent is in care, because they have to be isolated for Ebola. So I really respect this part of the treatment and system, that it's not just for the patient, but it's also for the children and the other loved ones that might want to be close to them, but need to still keep their distance.